Hello, everyone. Welcome to Cracking Addiction. My name's Dr. Fergal Armstrong, and today we're going to continue our discussion on prudent diets. So, previously we discussed the benefits of the Mediterranean diet, and we also emphasized the role of diet in health, personal growth, and also in recovery. So, following on from that, I want to introduce to you now the DASH diet. Now, the DASH diet was developed to deal with high blood pressure. And DASH stands for Dietary Approaches to Stopping Hypertension. And well, what's so important about stopping hypertension, you might ask? Well, we know that untreated hypertension causes kidney disease, kidney failure, heart disease, heart attacks, and strokes. And hypertension also makes a contribution to metabolic syndrome, which we discussed in previous episodes. And it's important to understand the micronutrients that are implicated in hypertension. So we need to think about reducing micronutrients that are implicated in the development of hypertension and those that are implicated in the management or the reduction of blood pressure. So foodstuffs that will increase your risk of blood pressure, well, obviously sodium, salt, but so too will alcohol and caffeine, and so too will the macronutrient saturated fat. And it's also been shown that water-only fasting has been shown to reduce hypertension, but that, of course, needs to be done with medical supervision. To improve blood pressure, to lower blood pressure, we know that the calcium, allium, i.e. Garlic, magnesium, or potassium, these substances are known to reduce blood pressure. So we've got foods that can increase blood pressure, and we've got foods that will decrease blood pressure. And looking at the relationship between blood pressure and potassium, we actually know that there have been several meta-analyses that suggested that high potassium intake lowers blood pressure. And the effect was actually measured as about 3.5 millimeters systolic and 2 millimeters of mercury diastolic pressure reductions. And this blood pressure lowering effect was greater in those who had high blood pressure, i.e. hypertension, compared to those who were normotensive. And so we also know that in the US, the average potassium consumption is 65 millimoles per day. But to actually achieve that blood pressure lowering effect, you actually need to go up to about 120 millimoles per day to actually get that blood pressure lowering effect. So that's blood pressure and potassium. We also know that the DASH diet is better than other plant-based diets for lowering blood pressure because it's a diet rich in fruit and vegetables. And the biggest reduction in blood pressure was within 2 to 4 weeks. And the DASH diet was able to reduce blood pressure by at least 6/3 millimeters of mercury. And furthermore, other studies demonstrated that the DASH diet was associated with a reduction in cardiovascular disease risk of approximately 13%, according to Framingham risk scores. So therefore, what's in the DASH diet? Well, again, we're always talking about principles of diet. So as we've said before, the DASH diet emphasizes fruits and vegetables, but it also emphasizes low-fat dairy products and limits saturated fat, limits red meat, limits sweets and sugar-containing beverages. And these resulted in a dietary reduction in sodium and an increase in the consumption of potassium, calcium, and magnesium. And of course, within the DASH diet, moderate amounts of alcohol were advised. And in Australia, moderate amounts of alcohol means no more than 10 standard drinks a week and no more than 4 standard drinks on any one day. Now let's look at sodium. The DASH diet was originally not conceptualized as a low sodium diet. But when one combined the DASH diet with a low sodium diet, they found that there was an increased blood pressure lowering effect. And this effect occurred within 2 weeks. So a diet containing sodium less than 2,400 milligrams a day, and that's roughly a teaspoonful of salt, there was a blood pressure reduction of 7/4 millimeters of mercury. If you lowered that to 1,500 milligrams a day, that blood pressure reduction went down to 9/5 millimeters of mercury. And again, people with pre-existing high blood pressure, or interestingly, people who identified as African American, benefited most from salt reduction. Now let's move to further evolution. So we've discussed the Mediterranean diet and we've discussed the DASH diet. If you combine the two, then you end up with a MIND diet. So the MIND diet stands for Mediterranean DASH diet, intervention for neurodegenerative delay. And the key here to understand is that this diet was developed to prevent the development of neurodegeneration, including Alzheimer's disease. And it emphasizes leafy green vegetables and berries, but does not score other types of fruit. So what's in the MIND diet? Well, effectively, there are 10 healthy food groups and there are 5 unhealthy food groups. So the 10 brain health food groups include green leafy vegetables, other vegetables, nuts, berries, beans, whole grains, seafood, poultry, olive oil, and wine in moderation. And the 5 unhealthy food groups include red meats, butter and stick margarine, cheese, pastries and sweets, and fried and fast foods. So why does it emphasize significantly the leafy green vegetables? Well, of course, leafy greens are a rich source of folate, vitamin E, carotenoids, and flavonoids. And these nutrients have been related to a lower risk of dementia and a lower risk of cognitive decline. And also we need to understand that the MIND diet emphasizes berries. So why berries? Well, again, the answer is that in animal models, berries improved learning and cognition. And also in the Nurses' Health Study, which was a long-term follow-up study of nurses in the US, the consumption of berries was associated with a slower cognitive decline. The MIND diet also recommends fish as part of the 10 brain health foods, but you only have to eat 1 portion of fish a week to lower your risk of dementia. And they find that there was no additional benefit for eating more frequently than once a week any fish dish. And why fish? Well, fish are a rich source of long-chain 3 fatty acids, so they reduce amyloid beta formation and oxidative damage. And it increases synaptic proteins and dendritic spine density. And these are markers of nerve health and nerve growth. Well, I hear you say, so what? Well, here's why. The people who emphasized and adhered to a MIND diet, their brains were 7.5 years younger than control subjects who didn't. And they had demonstrated slower levels of cognitive decline in episodic memory, working memory, semantic memory, visuospatial memory, and perceptual speed. The results were especially good for episodic memory, semantic memory, and perceptual speed. So there was global across the board benefit, but specifically there was very, very good evidence of a significant improvement in functions in those last 3, episodic, semantic, and perceptual memory. So that's why I think it's important to introduce people to the concept of the MIND diet for the protection of brain health, because, who are we without our brains? And then a final note on wine and the prudent diet. So, we're talking in the context of AOD medicine. So it's important to emphasize that for those who are on an abstinence journey from alcohol, wine or any other form of alcohol is not a necessary component of any diet. But for those who are aiming to control their alcohol consumption, then the Australian guidelines do emphasize no more than 10 standard drinks a week, no more than 4 standard drinks in any one day. And in Australia, a standard drink is 10 grams. So that's overall 100 grams of alcohol a week. Now, bear in mind that the Canadian guidelines actually state that to avoid alcohol-related consequences to yourself and others, you shouldn't be drinking any more than 1 to 2 standard drinks per week. So just keep that in mind when you're considering abstinence, optimal health, and certainly optimal brain functioning. So hopefully I've demonstrated to you 3 key diets that are good for people who are interested in long-term health, long-term protection for their brains and their hearts. And hopefully I've emphasized the role of good diet in AOD medicine and also recovery. That's all for today, folks. My name's Dr. Fergal Armstrong, and we'll see you next time.